You've just experienced something violent, something scary, something traumatic. Forensic nurse examiners are here to help. Now, these highly trained nurses are here to support people of all genders who have recently experienced sexual assault or partner violence. If you or a loved one ever need their support, we want to walk you through what to expect. All right, so we're here to meet Hannah. Hannah, thank you so much for having us here.
Yeah, hi Zara. My name is Hannah Varto. I'm a nurse practitioner. I work with the Forensic Nursing Service in Fraser Health. Today we're at Surrey Memorial Hospital, and I'm going to walk you through what happens when we come to see a forensic nurse and what happens with the forensic nurse in our private suite.
All right, let's go inside. Great.
The whole thing can feel scary and overwhelming, and absolutely you've had some control taken away from you. And we're here to help you regain some of that control. We can't change the past, but we can maybe help things get better. First of all, you're going to meet with the triage nurse here at the triage desk. The triage nurse is going to make sure that you're okay. The nurse will take your vital signs and assess and ask you if there's any injuries or any questions about the incident. After that, they'll offer you the choice of seeing a forensic nurse examiner. And if you'd like to do that, then we'll page the forensic nurse examiner and they will arrive usually within an hour.
Okay, so it's the usual getting my temperature check, my blood pressure, all that sort of stuff. And then I have a choice after.
Absolutely. Everything we do here is completely by choice, and all of your options will be discussed with you.
Okay, and where are we heading next?
We're going to walk down to the forensic nurse examining suite, and this is a private space where you will wait for the forensic nurse examiner to arrive. In Fraser Health, our forensic nursing service sees people ages 13 and up within 7 days of their violent experience. You might meet with a social worker, you might meet with a victim support worker while you're waiting, or with the forensic nurse.
Hi, I'm Zara.
I'm Larena. I'm the forensic nurse examiner.
I know we're here at Surrey Memorial Hospital right now, and I know you also have a team at Abbotsford Regional Hospital, but if I end up at a different hospital and I need your support, what happens then?
It's no problem. Patients can go to any hospital within Fraser Health, and once the emergency department team has determined that they're healthy and well and all of their medical needs have been addressed, they would call our consult phone and determine where there's a forensic nurse available, either at Surrey Hospital or at Abbotsford Regional Hospital.
And then would you help me transfer over there if I can't make my way over there?
Yes.
What happens next? Where are we right now?
As long as a patient's comfortable, we bring them back to this space here. This is what we call our forensic nursing suite. It's a nice calm environment away from the busy emergency department, where our forensic nurse can sit with our patient and talk to them about options for care. The forensic nurse is here to provide information, talk about potential outcomes for decisions that patients get to make, and walk patients through the decision that's right for them.
This is where we decide what's going to happen in the exam.
Exactly. We move next door into our actual exam room where the physical hands-on care is done.
Now, do the police come here, or how do we make that decision on what actually takes place and who finds out?
We can offer medical care and we can offer forensic care. Medical care would be things like a head-to-toe assessment to make sure there's no injuries that maybe we need to address, or call on our physician in the emergency department to help us with. We review medications that might be helpful to prevent things like unwanted pregnancy, STIs, things like that. The other piece that we can offer patients is what's called a forensic exam. So a forensic exam is an evidence exam. So we're doing a very, very detailed head-to-toe examination, as much as our patients are comfortable with. If there's a part of their body that they don't want us to look at, we won't do that. We can offer that full forensic exam, and then the patient gets to decide what they want to do with it. They can either ask us to give everything to police because they do want to report the incident to police, and so we facilitate that, or they're not quite sure what they want to do, or now's not the right time, so we can hold on to that information, giving them time to decide what they might want to do.
Okay, so you've talked about choices in here, and then you head over to the exam room.
Yes, that's
okay.
Right. Yeah.
All right, so this is the exam room.
This is the exam room, yes.
Okay. Walk me through what would happen the moment I walk in here.
We might have an opportunity to collect clothing if the patient is wanting to release that to police. And then we move them into our exam space. There's sort of a wide variety of items that we might use during a typical medical forensic exam. Some examples include our alternate light source. So this is a light that fluoresces substances on a person's skin. It's just a blue light, and we use our orange goggles to help detect areas of fluorescence. Some other tools that we have here, we have our swabs. These are the swabs that we would use to swab patient's body, both externally and potentially internally, based on the patient's comfort and consent. So we collect blood for two reasons, again, based on the patient's decisions. We can test medically, so testing for STIs, things like that. And we can also do forensic blood work, which would be for toxicology. So if there's a possible drug ingestion that was part of the incident, then we could do some toxicology in the form of blood and urine. So as we're doing our head-to-toe examination, we're taking time to carefully measure each item that we see on the patient's body.
So say my tattoo is a mark over there, you can measure exactly what that is.
We would come in and we would measure the item, and then we would document it carefully on our documentation. We can offer them forensic photography. So this is our camera system here. And with this device, we would again take now photos of every finding that we see on their body. Here we have evidence tape. It's really important that any forensic evidence that is collected, we're able to maintain chain of custody. And this is another tool that we use. So as we're doing our forensic exam now, and we're taking our time to carefully assess and document all the findings, we would actually draw them on various body diagrams. So we would draw, let's say there was a bruise on the right shoulder, we would draw it here, and then on this document here, we would indicate all of the specifics about that particular finding.
So I'm looking at this room. Obviously, you've got the exam bed, you've got all of these tools, probably a lot for anyone coming into here that hasn't come into this space. Do you ask for consent throughout? Is it a continuous question?
Every step, yeah, every step of the way. And if our patient needs to stop or take a break, then absolutely we do it. We do what our patient wants and we go at their pace. Some of our exams can take 20 minutes and some of our exams can take 4 hours.
What would your message be to them about having the ability to make that decision and control it?
Know that we're here, know that we want to help, and know that you don't need to do any of this alone.
The forensic nursing exam is really only one step in your journey.
Okay.
If you choose, we can offer you follow-up care too at Embrace Clinic.
Okay.
Welcome to Embrace Clinic.
If I've gone through the forensic exam and I've decided I do want to be contacted by Embrace Clinic, how does that work?
All right, so Embrace Clinic will contact you within about 3 days after your hospital visit, and we'll offer you either a phone or an in-person visit appointment. The purpose of Embrace Clinic is to provide medical follow-up, and we can answer questions about your hospital exam, and we can treat things like sexually transmitted infections, injuries. If you've been strangled or maybe hit in the head, you might have a concussion or some head and neck pain, and we do a lot of work with that as well. Well, I want to remind people that we believe you and we will support you and your decisions on what you want to do next. Our focus is always making sure that you are okay first. Then we can talk about all the other options after that. So when you walk through our doors, whether it's at the Forensic Nursing Service or whether it's at Embrace Clinic, we believe you and we'll be here for you.